So there's many counties that University Hospitals Cleveland Medical Center covers. In Northeast Ohio, it's a broad area that we cover. The hospital system has acquired a lot of outpatient facilities as well as community hospitals. So there's a lot of places that we cover. In our radiology department, the breast imaging section covers certain areas, but not all areas of breast imaging, but we are considered the specialists, so any MRI that's done in the system is read by us, and any MRI biopsy within the system is done by us at certain locations. And so we screen with digital breast tomosynthesis, digital mammography, breast ultrasound, and MRI for high-risk women. However, we are going to start offering next month abbreviated MRI for patients with dense breasts at either normal risk or slight increased risk for them. We also offer diagnostic ultrasound, diagnostic MRI. We do biopsies with stereotactic guidance, ultrasound guidance, and MRI guidance as well. Sectra is very easy to use. It's very user-friendly for the radiologist. We're able to page through tomosynthesis exams very easily. We have specific hanging protocols for tomosynthesis, and it's very easy to compare current images to prior images, to leaf through prior images very quickly. If we need to toggle back and forth between the 2D mammogram or the C-view and the tomos stack of slices, it's very easy to do that with both the keypad or the keyboard, and so we're very efficient with that. Now that we have our hanging system down, we're able to have all our imaging together comprehensively, including our ultrasounds and our MRIs and our tomos and our 2Ds and our C-views and everything together in one system, so we can look at it all together very quickly and come up with a very concise dictation, specifically for patients with diagnosis of breast cancer who have gone through all of the diagnostic imaging, and at the end we can put all of that together and come up with one final dictation, and we're able to guide our referring clinicians to kind of extent of disease, what are the next steps, what are the response to chemotherapy, where are we right now, where we might want to go with imaging, and how we can help them, help the patient on her journey through her cancer experience. The other nice thing that we like in the breast imaging section is that we can send chat images to each other across the system. We commonly don't work together in our section. I have 7 women that are breast imagers in our section, and we are spread at 6 different sites, and so we were able to consult each other without calling each other. With the chat function, we can link our study to that person. They can just click on the link, open it up, give their opinion, and send it back, and not have to miss a beat in the flow of the day. The other time that chat really helps us is to work with the technologists. We have a central nervous system in our breast center, and there is a workstation technologist that sits at the workstation, and she is the commander of the day, and she's kind of like an air traffic controller, and she knows what's going on the floor with the patient. She's communicating with us as radiologists, and we're letting her know what extra views we need. Try this. Oh, this patient needs to go to ultrasound. Is this patient done yet? Are we ready to go with our biopsy? Without calling anyone or interrupting, you're able to receive those chats when you have a minute to open that up and take a look at it. So it just makes your day much more efficient and easier to focus on the case that you're dealing with at the time. I like being able to quadrant zoom through things to look for calcifications. I also like the invert button sometimes to look for areas of distortion. And I just like the fluidity of being able to page backwards through old exams as well, all the way back to the beginning, and being able to toggle back and forth between old exams and new exams. The other thing I like is being able to toggle between the C-view, the tomo, and the 2D as well. That's really helpful. The hanging protocols are uniform for all the radiologists reading. We don't have individual hanging protocols. Everyone in a democracy, we all kind of sit down together and figure out which hanging protocols we wanted and made them happen. We worked with the technologists as well and the IT PACS people and set up our hanging protocols, which really haven't changed in the last probably 6 years. We may end up, kind of cutting them down now, but we'll see with the new C-view, synthetic view that we're going to try to launch in the next couple of months. So in our clinics, we are able to communicate our BI-RADS category, and when the patient needs to come back on our diagnostics, we will put that in the comments section. They have access to that, so they know exactly without having to come in and review every case like we've done in the past. So on the easy, category 2 or, cat 3, 6-month follow-up or 1-year follow-up, whatever we put in there, they know what we want to do before we dictate the case. So they're able to see the patient without having to come in and talk to us. So it's a much more efficient workflow for them when we work and we're integrated into their clinic. It's also helpful for surgeons, nurse practitioners, and oncologists to be able to open packs in the exam room and go over images with the patient, to talk to them before they have their biopsy, to show them the images, show them what the lesion looks like, show them how big it is, where it is in the breast, how worried we are about it. And I think the images really help convey what's going on with the patient and what the next plan is. So oncologists or surgeons can also show patients their response to chemotherapy before they go to surgery. So if they see an MRI or a mammogram or an ultrasound before chemotherapy versus after chemotherapy, they can really show if the patient had a good response to chemotherapy, what the difference is between the before and after pictures. I think Sectra listens to their customer and responds to their customer. I've had many Sectra representatives come and sit with me at the workstation and ask me what works and what doesn't work, and they try to respond to what our needs are.